Hi, Nurse William here. Today we're gonna talk about the Broselow tape. This is a very, very important tool that we use when we are in a pediatric resuscitation situation. I'm going to introduce it to you through a video clip of the show that got my whole career started, ER, and they actually use the Broselow tape. And then we're going to discuss the clip a little bit after, so that way I can better explain how to use this Broselow tape and the importance of knowing the correct zone in the Broselow tape. So here's the clip. It talks about how there's a 3-month-old in respiratory distress. He's hypoxic. The doctor doesn't know what tube to use, what medication, how to do a rapid sequence induction, how to basically resuscitate the kid until the pediatric ER doctor comes in, pulls out the Broselow tape, determines the zone, and that better guides the care. So we're going to watch the video, and then we're going to discuss, and I'm going to go more into depth with the Broselow tape.
Right now, 6-month baby boy respiratory distress.
Abby?
Just hold on one second.
Just 1 or 3 course crackles bilateral.
Pulse ox is only 75.
Let's take a look. Sounds like pneumonia. Now let's get a pediatric intubation tray moved now, people.
We got a line. I'll draw CPC and blood culture.
Damn, I don't even do pediatric intubations. Where's Cleo?
She took a kid to pick you.
Get her down here now. What size tube?
We use 2.5 in the delivery room.
No, I think I need something bigger. 3.5? I don't know.
Got the labs.
He's clamped down. I can't get the blade in.
Paralyzing.
What's the dose?
You need his weight.
He's vomiting. Suction.
Pulse ox is dropping. What do we have?
Difficult intubation. I can't dose him without a weight.
That's what the Broselow tape is for. Okay, we're in the red zone. 2.6 of etomidate, 18 of suts. Pre-medicate with 0.17 of atropine, 14 of Lido. Bag and keep some cricoid pressure.
I couldn't see the cords.
That's because you had the wrong blade and the wrong tube.
How imperative it was for Dr. Benton to know what exactly equipment he was using, the medication dosages, the size ET tube, all that's imperative because in these situations, as I mentioned in pediatric assessment triangle, time is important. These are your sickest kids. These kids are going to crash. They're at a greater room for complication. So as I said here, medication in the pediatric setting is weight-based. And sometimes it is very hard in a code or a drowning situation, and time is of the essence. You're on a timer. So you need to be able to know the patient's weight. The Broselow tape is length-based. So based on the length of the patient, it estimates the weight of the patient. So in the case study, when Dr. Finch comes with the Broselow tape, because he had the wrong blade, wrong tube, she's like, oh, that's what the Broselow tape is for. We're the kids in the red zone. So I pull my Broselow tape. Kids in the red zone, so approximately 8 or 9 kilograms. Based on this, she has the patient's dosage of 0.1 of atropine, bag on. 0.18 of atropine. It's got your fluid type. It's got your managing of ICP, your seizure dosages, your overdose hypoglycemia dosages, the type of equipment you're going to use, the RSI, the resuscitation drugs in the code. And in the emergency room, in the pediatric setting, when there is a pediatric code cart, crash cart, however, whatever the term that you want to use, they have drawers based on this, right? So the gray drawers, top drawer, pink drawer, red drawer, purple drawer. It's just based on that, it has your equipment, your meds, the things you need to run that code based on your color code. That's why I emphasize that the Broselow tape is the color, is your 6 vital sign. In a situation where you're in an arrest, you're on meds, you're running the code, what's my color? You need to be able to ask that. Even in a patient, just to have the patient's Broselow tape color, it's not going to hurt the patient, right? All you do is lay the tape to the head of the bed, and you go down, okay, and then you stop based on the patient's color zone, and go from there. It can never hurt to know your patient's color, as I mentioned, because patients tend to crash quickly, and you need to know what color zone that patient's in, so you could do care, run the code in a more organized fashion. So I know in the code situation, resuscitation for a seizure patient, in situations where you don't know the patient's weight, things are chaotic, things are frantic, this kind of simmers things down a little bit. It creates a little organization in a controlled, chaotic situation. I hope this video helps you understand the Broselow tape a little bit better. There's other tools that are also just as effective and helps when, chaos is hitting the fan. It's got a lot of important information beyond the color code of the patient. It's a very useful tool, and I hope this helps, and happy studying.